Welcome to Arirang Live. It's 11 a.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the coronavirus outbreak. There are regular briefings given twice a day, one at 11 a.m. and another at 2 p.m. by the Central Disease Control Headquarters. As of Saturday morning, South Korea has confirmed a total of 8,799 confirmed cases. With additional 8 deaths, the death toll now stands at 102. And over 2,600 patients have been sent home after making full recovery. Now the briefing is about to start, so let's take a listen.
We also have sign language translation available. The briefing will be given by Mr. Yoon Tae-hoo, the Chief of Quarantine Supervision Department, and be followed by the Q&A session. And here is Mr. Yoon Tae-hoo. Let us now begin our regular briefing for March 21st, Saturday. As of today, midnight, the total number of people who are in quarantine amounts to 6,085. Of them, 2,612 have been discharged following full recovery, and the new death toll stands at 102. And the total number of confirmed cases stands at 8,799, up 147 from the day before. The death toll was increased by 8. Prime Minister Chung Se-kyun convened a KCC meeting this morning, during which he touched upon issues including the Bundang Jaeseng Hospital, as well as the outbreak seen in the Daegu nursing home called the Daesil Nursing Hospital. And he also touched upon the issue of a mass supply of face masks. And Prime Minister Chung Se-kyun also said that regarding the conducting of testing on all arrivals from Europe starting from midnight of March 22nd, he said that this is an inevitable measure to curb the inflow of imported cases. And he asked for all of the related ministries to take participation and cooperation. First of all, we would like to brief you on the testing of all arrivals from Europe. With the surge in the outbreak of coronavirus among Europe, from the 22nd of March, midnight, we will be conducting the screening tests on all arrivals from Europe. And we have briefed you yesterday that we will heighten our protection on our borders as well as our screening measures. And all of these people who are arriving from Europe will have thermal screenings. And based on these thermal screenings, depending on their symptoms, they will be moved to each of the quarantine facilities, and about 198 rooms will be available for quarantine. If those of these people do not have any symptoms, they will be screened, and after that they would go to will be deported to 7 facilities around the Incheon area, where there are 1,000 rooms available for them. And we will mobilize an additional of 200 people who will help to carry out such intensified quarantine. And if they are tested positive, they would move directly to designated hospitals nearby or live treatment centers, depending on the severity of their symptoms. In order to intensify the effectiveness of the screening, even though they are tested negative, they will all still undergo quarantine. And if they have residences in Korea, they would be on self-quarantine for the next 14 days. And if they just come to Korea for a short period of time, like business trips, they will be quarantined via telephone every day by the personnel of the welfare ministry. And they will also need to download the applications so that they can prevent the curb of the spread of the virus. And if the foreigners breach the measures of self-quarantine, they will also be subject to 3 million penalties, just like Korean nationals. In order to further curb the imported cases of coronavirus, we are eyeing our attention on the imported cases, and we advise you to stay at home if you just arrived from abroad. And please call our 1339 call center or the public health facilities. And the families and the Korean nationals and their families who came in from Iran, we have moved about 80 people from Iran to Incheon, and they all have been conducted of the screening testings. And for the people who had 2 symptoms, we had no positive cases. But out of the 78 people without symptoms, we have identified additional cases. So they have been moved to undesignated hospital at Seongnam, and the rest of the 79 people who are in the Koika Center at Seongnam will be still put on quarantine, and they will be monitored by the personnel from each of the related ministries. And the facility also has medical doctors who will help out with them if they have any symptoms. And the headquarters, we would like to further curb the spread of the virus within our community, and we will intensify our quarantine measures going forward. In Daegu and Gyeongbuk region, we have seen additional cases, and we have our on-day increase of confirmed cases was up by 147. In Daegu from yesterday, about 69 people were diagnosed with the virus, and in Gyeongbuk and Daegu, by total, more than 100 people have been reported positive. And most of those cases were centering around the nursing hospitals, which house patients of elderly population, as well as those patients with chronic underlying illnesses. We have carried out twice of the enumeration investigations, and we have also monitored the guidelines of quarantine. And for nursing hospitals, we have conducted the testings and the investigations on all of those who had symptoms of pneumonia. However, we have witnessed that some of the nursing hospitals failed to abide by such quarantine measures. Therefore, the government will take measures to provide support for the nursing homes going through difficulties. So because the nursing homes are subject to intensified quarantine, we will be expanding our financial support for these nursing hospitals, and we also will postpone them of the reportings of any of the administrative measures that the nursing hospitals need to carry out. And we also talked with our related ministries to provide more protective face masks through the hospital associations in each of the city and provinces, so that we can give more face masks to the healthcare providers who are working at the nursing hospitals. We thank all of those who are working on site once again, but considering the fact that nursing hospitals is very much prone to the virus infection, we ask you to comply with these measures even strictly. If you have fever, muscle pain, or any kind of respiratory symptoms, please refrain from going to work if you are working at these nursing hospitals. And we also urge the administrative staff at the hospitals to take this into consideration. With the rapid outbreak of the coronavirus globally, and considering the fact that we are witnessing sporadic outbreaks here in Korea centering around nursing hospitals, we need to curb the virus. Considering the fact that the coronavirus is very contagious even at the beginning stage, this this epidemic seems to be go prolonged in the near future as well. Therefore, we need to highlight once again the personal hygiene and social distancing measures. This will not only protect yourself and your family members, but also the entire community. As we have going into near spring and during the weekend, although you would like to go outside to enjoy the weather, I hope that you could stay indoors and keep the personal hygiene measures. I hope that you could also share messages of hope to all of your loved ones. And thank you once again for exerting your civil awareness, as well as all of the medical staff who are fighting on the scene to fight against the coronavirus. Thank you very much.
네, 질의응답 시간을 가지겠습니다. 배석자분들은 단상 위로 올라와 주시기 바랍니다.
That concludes our live coverage of this briefing. And just a wrap up from the briefing, South Korea has confirmed a total of 8,799 cases. That's up 147 from yesterday. And with 8 additional deaths, the death toll now stands at 102. We have another briefing coming up later in the afternoon. We'll again be providing live coverage of that session to make sure you're entirely up to date with the situation. Bye for now.